There is a number being recorded inside your body right now that your doctor has almost certainly never seen. Not your morning reading, not the one taken at your last appointment. The number I am talking about is your blood pressure at 2 in the morning, at 3, at 4, the readings that happen silently while you sleep, while no one is watching, and while the damage accumulates without a single symptom to alert you. After 60, this is where cardiovascular risk lives. And tonight, I'm going to show you exactly what you can do about it before you go to bed. My name is Dr. Pardip. For more than 20 years, I have worked in cardiovascular and metabolic medicine with a focus on adults over 50. I have reviewed the overnight blood pressure data of thousands of patients, and I can tell you with confidence that what happens during sleep is a more powerful predictor of heart attack, stroke, and kidney failure than almost any daytime measurement a doctor takes. The tragedy is that most people have no idea their nighttime profile even exists, let alone that it may be quietly working against them every single night. What I am going to give you today is a specific evidence-based evening protocol built around 5 drinks, each targeting a distinct biological mechanism that governs what your cardiovascular system does while you sleep. To understand why any of this matters, you first need to understand what a healthy cardiovascular night looks like and how profoundly it changes after 60. In younger adults with healthy vessels, blood pressure follows a predictable rhythm. It rises in the morning, fluctuates through the day, and then, as sleep begins, it drops. That drop, typically 10 to 20% below daytime levels, is one of the most important cardiovascular events in the human body. During that window, the inner lining of blood vessels repairs oxidative damage. The heart muscle recovers from its sustained daytime workload. Inflammatory proteins circulating in the bloodstream begin to clear. Stress hormones fall. The kidneys shift into overnight sodium excretion that reduces vascular volume by morning. It is a full cardiovascular reset, and it happens every night, or at least it should. After 60, this reset becomes unreliable in ways that standard care almost never detects. Arterial walls that have stiffened over decades cannot dilate as freely in response to the nervous system's overnight signals. The balance between the sympathetic nervous system, which drives alertness and pressure, and the parasympathetic nervous system, which drives rest and recovery, tilts toward the sympathetic side. Kidneys working at reduced capacity retain sodium overnight rather than excreting it, keeping vascular volume higher than it should be through the night. The result, for a significant proportion of adults over 60, is that blood pressure either fails to drop during sleep or actually rises. Cardiologists call this non-dipping and reverse dipping. Large-scale research documents that non-dippers face cardiovascular event risk 2 to 3 times higher than those who dip normally, even when their daytime numbers appear controlled. The pressure surge happens in the dark, in the silence, while the person sleeps soundly and feels completely fine. What you drink in the hours before bed directly influences whether that overnight reset happens or fails, not because any drink is a cure, but because specific compounds in specific beverages interact precisely with the systems that govern nocturnal blood pressure: the autonomic nervous system, the endothelium, the kidney's sodium handling, the vascular smooth muscle, and the inflammatory environment inside the arteries. 5 drinks, 5 mechanisms. The first is beetroot juice, diluted and consumed about 90 minutes before bed. Beetroot is one of the most concentrated dietary sources of inorganic nitrates available. When consumed, bacteria on the tongue convert nitrates into nitrite, which the body then converts into nitric oxide, a molecule that acts directly on the smooth muscle surrounding blood vessels, causing them to relax and widen. This is vasodilation, and it is one of the primary mechanisms by which blood pressure falls. A meta-analysis of 16 randomized controlled trials found that beetroot juice supplementation produced average systolic reductions of 4 to 5 millimeters of mercury, with some trials showing reductions as high as 10 millimeters in those with elevated baseline pressure. For seniors specifically, this pathway is critical because the endothelium's own nitric oxide production declines significantly with age. Dietary nitrates from beetroot directly compensate for a system that has genuinely lost capacity. Mix 4 to 6 ounces of unsweetened beetroot juice with an equal amount of water. Do not use mouthwash immediately before or after, as antiseptic rinses kill the oral bacteria needed to convert nitrates, eliminating most of the benefit. The second is warm passion flower tea brewed for 8 to 10 minutes and consumed about 45 minutes before sleep. Most people have never encountered this one, and that is a significant gap. Passion flower contains a group of flavonoids, including chrysin and vitexin, that enhance the activity of GABA, the brain's primary calming neurotransmitter. GABA works by inhibiting the firing of neurons in the sympathetic nervous system, the system responsible for the fight or flight response that keeps blood pressure elevated. A clinical trial published in Phytotherapy Research found that passion flower extract significantly reduced both anxiety scores and physiological markers of sympathetic activation. This is directly relevant to nocturnal blood pressure because one of the most common drivers of non-dipping in seniors is sustained sympathetic tone through the night, the nervous system failing to downshift as deeply as it should. Think of the sympathetic nervous system after 60 as an engine that increasingly forgets how to idle. Passion flower tea helps it remember. The third is warm flaxseed water. 1 tablespoon of ground flaxseed stirred into 8 ounces of warm water, left to sit for 5 minutes, then consumed about 60 minutes before bed. Ground flaxseed contains 3 compounds, each independently relevant to blood pressure. Alpha-linolenic acid, an omega-3 fatty acid, reduces arterial inflammation and improves endothelial responsiveness. Lignans reduce oxidative stress in arterial walls and improve the flexibility of vessels stiffened by age. Soluble fiber slows absorption of dietary sugars and reduces insulin spikes. Important because insulin resistance, nearly universal in seniors with metabolic issues, elevates overnight blood pressure through sodium retention and sympathetic nervous system stimulation. A randomized controlled trial published in Hypertension found that daily ground flaxseed consumption over 6 months produced an average systolic reduction of 15 millimeters of mercury in patients with elevated pressure, among the largest dietary reductions ever documented in a controlled setting. Use ground flaxseed only. Whole seeds pass through largely intact without releasing their active compounds. The fourth is warm spearmint and lemon balm tea, brewed together for 8 minutes and consumed 1 hour before sleep. These two herbs are rarely discussed together in blood pressure contexts, but their mechanisms are complementary in a way that is directly relevant to overnight cardiovascular regulation. Lemon balm contains rosmarinic acid, which inhibits the enzyme that breaks down GABA in the brain. By slowing GABA degradation, lemon balm extends the calming effect of the brain's own chemistry, reducing the nighttime cortisol surges that are among the most common causes of non-dipping in people over 60. Spearmint independently contains compounds that reduce oxidative stress in the endothelium, with emerging human data supporting modest vascular benefits. A published clinical study on lemon balm found significant reductions in stress markers with effects extending through sleep. 1 teaspoon of each herb brewed together produces a gentle drink with an excellent safety profile that is well tolerated by nearly everyone. The fifth is warm water with apple cider vinegar and cinnamon. 1 teaspoon of apple cider vinegar, and a quarter teaspoon of ground cinnamon dissolved in 8 ounces of warm water, consumed about 90 minutes before bed. Apple cider vinegar contains acetic acid, which has been studied for its effects on insulin sensitivity. The connection to blood pressure is direct. Insulin resistance drives pressure elevation through 2 mechanisms. First, insulin causes the kidneys to retain sodium, increasing fluid volume in the bloodstream. Second, elevated insulin stimulates the sympathetic nervous system. Research published in Bioscience, Biotechnology, and Biochemistry found that acetic acid improved insulin sensitivity and reduced post-meal glucose responses in human participants. Cinnamon adds a second layer. Its active compound cinnamaldehyde has been shown in clinical trials to improve endothelial function, reduce inflammatory markers, and produce modest reductions in systolic blood pressure. Allow some time after this drink before lying down, as the acidity is best buffered away from bedtime. Those with acid reflux or gastroparesis should use this one with caution. 3 things to do tonight before anything else. First, look honestly at what you are consuming within 2 hours of bed. Caffeine stays active in the body for 6 to 8 hours. A cup of tea at 4 in the afternoon still has meaningful stimulant activity at midnight, keeping sympathetic tone elevated and blocking the nocturnal dip. Second, check any evening medications or cold remedies for pseudoephedrine or phenylephrine. Both directly constrict blood vessels and can significantly elevate pressure during sleep. Third, ask your physician specifically about ambulatory blood pressure monitoring, a small cuff worn for 24 hours that records pressure automatically every 30 minutes, day and night. It is the only way to see what your cardiovascular system is actually doing during sleep, and it is the gold standard for identifying non-dipping patterns. Most people over 60 who would benefit from it have never worn one. The heart works without pause, without rest, without complaint, every hour of every night for every decade of your life. After 60, it deserves more than a 30-second reading once every few months. It deserves an evening routine built on what the evidence actually shows. Start with 1 drink tonight. Build the protocol gradually over the following weeks. If this kind of evidence-based analysis is useful to you, please share it with someone over 60 who deserves to have it. Subscribe for more and leave your questions in the comments below. I read every one. I will see you in the next video.